TN MRB 2023 ஏப்ரலில் கண்டக்ட் பண்ண MRB Pharmacist எக்ஸாமோட கொஷின் பேப்பர் தான் இப்போ நம்ம டிஸ்கஸ் பண்ண போகிறோம். லாஸ்ட் இயர் 2023 ஏப்ரல் 26 அண்ட் 27 வந்து 4 பேட்சாக வந்து இந்த MRB Pharmacist போஸ்ட்டுக்கான கம்ப்யூட்டர் பேஸ்ட் டெஸ்ட் கண்டக்ட் பண்ணியிருந்தாங்க. அதில் இருக்கக்கூடிய பேட்ச் 1 26 ஏப்ரல் மார்னிங் நடந்த கொஷின் பேப்பர் தான் இப்போ நம்ம டிஸ்கஸ் பண்ண போகிறோம். ஓகே, ஃபர்ஸ்ட் கொஸ்டின், தி டேர்ம் லிப்ரா மீன்ஸ் pound, grain, scruple, gallon. The correct answer is the term Libra means option A, pound. The Indian Pharmacopoeia Commission was established in the year 2006, 2005, 2004, 2003. The Indian Pharmacopoeia Commission was established in the year option B, 2005. Next question. Lymphocytes constitute dash percentage of circulating white blood cells. 2 to 10%, 1 to 3%, 20 to 40%, 40 to 60%. Lymphocytes constitute 20 to 40% of circulating white blood cells. Next question, hematuria is presence of dash in urine. White blood cells, platelets, red blood cells, epithelial cells. Hematuria is the presence of RBC, red blood cells in the urine. Next question. Name the enzyme which is used in the treatment of leukemias. Asparaginase, protease, DNA polymerase, alkaline phosphatase. Correct answer is enzyme which is used in the treatment of leukemias is option A, asparaginase. Next question, all amino acids have optical isomers except threonine, phenylalanine, valine, glycine. Correct answer is option D, glycine. Next question, the biochemical test used to detect ketone bodies in urine is Benedict's test, Rothera's test, Hayes test, benzidine test. Biochemical test used to detect ketone bodies in urine is option B, Rothera's test. Next question, the lipoprotein that transports cholesterol from peripheral tissue to liver is. Lipoprotein that transports cholesterol from peripheral tissue to liver is high density lipoprotein, low density lipoprotein, very low density lipoprotein, chylomicron. Correct answer is option A, high density lipoprotein, HDL. Next question, question number 9. Drug of choice for mass drug administration in case of filariasis is options rifampicin, tetracycline, diethyl carbamazine citrate, mebendazole. Drug of choice for mass drug administration in case of filariasis is option C, diethyl carbamazine citrate. Next question, trismus is the most common symptom of typhoid, diphtheria, tetanus, gonorrhea. Trismus is the most common symptom of, correct answer is option C, tetanus. Next question, which of the following is not water washed disease? Scabies, trachoma, cholera, shigellosis. Which of the following is not water washed disease? Correct answer is option C, cholera. Next question, BCG vaccine provides protection against pulmonary tuberculosis, CNS and disseminated tuberculosis, pulmonary and CNS tuberculosis, pulmonary and skeletal tuberculosis. Correct answer is BCG vaccine provides protection against CNS as disseminated tuberculosis. Next question, question number 13. Vanaspati ghee is fortified with iodine, vitamin A, iron, calcium. Vanaspati ghee is fortified with option B, vitamin A. Okay, next question, one of the following contains maximum calcium? Rice, wheat, ragi, jowar. One of the following contains maximum calcium. Correct answer is option C, ragi. Next question, a state of rigidity of muscle fibers after death is called atrophy, rigor mortis, hypertrophy, tetanus. State of rigidity of muscle fibers after death is called? Option B, rigor mortis. Next question. Dash are the receiving or input portions of a neuron? Dendrite, axon, nucleus, myelin. Correct answer is option A, dendrite. Dendrite are the receiving or input portion of a neuron. Next question. Vomiting center is located in the options medulla, pons, midbrain, cortex. Vomiting center is located in option A, medulla. Next question. The most essential element required for the formation of thyroid hormone is? Most essential element required for the formation of thyroid hormone is calcium, iron, magnesium, iodine. Correct answer is option D, iodine. The most essential element required for the formation of thyroid hormone is option D, iodine. Next question. QRS complex in ECG is due to ventricular depolarization, ventricular repolarization, atrial depolarization, atrial repolarization. QRS complex in ECG is due to option A, ventricular depolarization. Next question. Duration of atrial distole is 0.1 second, 0.3 seconds, 0.7 seconds, 0.5 seconds. Duration of atrial distole is 0.7 seconds. Option C is the correct answer. Next question. The type of collagen fibers present in the connective tissue of a tendon is? Type of collagen fibers present in the connective tissue of a tendon is type 1, type 2, type 3, type 4. Correct answer is option A, type 1. Okay, next question. The red pigment hemoglobin is present in red blood cells, white blood cells, platelet, cell wall. Red pigment hemoglobin is present in option A, red blood cell. Next question. In which year of 11th August Drug Enquiry Committee was appointed by the Viceroy of India? In which year of 11th August Drug Enquiry Committee was appointed by the Viceroy of India? 1948, 1930, 1955, 1940. Correct answer is option B, 1930. Next question. Among the following, which one is not in the Code of Pharmaceutical Ethics for a qualified registered pharmacist? Which one is not in the Code of Pharmaceutical Ethics? Conduct of pharmacy, handling of prescription, training apprentice, disclose the secrecy of the prescription. Correct answer is option D, disclose the secrecy of the prescription. Okay. Next question. Advertisements claiming cure of cancer is an example of dash type of advertisement. Advertisement claiming cure of cancer is example of prohibited, exempted, bona fide, permitted. Correct answer is prohibited type of advertisements. Curing of cancer is a prohibited type of advertisements. Next question. The Education Regulation 1991 was laid down by? Education Regulation 1991 was laid down by Central Government, State Government, Pharmacy Council of India, State Pharmacy Council. Correct answer is option C, Pharmacy Council of India. Education Regulation 1991 was laid down by Pharmacy Council of India. Next question. Mention the form numbers in which import license is granted for drugs specified in Schedule C and C1, excluding those specified in Schedule X. Okay. Mention the form numbers in which import license is granted for drugs specified in Schedule C and C1, excluding those specified in Schedule X. Form 10, Form 10B, Form 14, Form 24. Correct answer is option A, Form 10. Next question. Schedule N of Drugs and Cosmetic Acts deals with options: list of minimum equipment for efficient running of pharmacy, standards of cosmetics, standards of disinfectant fluids, standards for surgical dressing. Correct answer is option A. Schedule N of Drugs and Cosmetic Act deals with list of minimum equipment for efficient running of a pharmacy. Next question. Question number 29. Extractive industries are also called dash industries: exhaustive, synthetic, genetic, manufacturing. Extractive industries are also called exhaustive industries. Option A is the right answer. Next question. Poisonous medication should be handled with caution and separated from other medication, kept in refrigerator, kept in room temperature, should be kept with general medications. Poisonous medication should be handled with caution and separated from other medication is the right answer. Option A. Next question. Trial balance is a ledger, statement, account, summary. Trial balance is a statement, summary. Both option B and D is the correct answer. Next question. Working capital ratio is also known as liquidity ratio, current ratio, solvency ratio, efficiency ratio. Working capital ratio is also known as current ratio. Okay, next question. Unit Trust of India UTI was established in 1964, 1951, 1985, 1995. Okay, Unit Trust of India was established in the year 1964. Okay, next question. Dash technique is used to find out how much of inventory is to be ordered. How much of inventory is to be ordered? VED, bin card, EOQ, IO ratio. Correct answer is option C, EOQ. Next question. The first National Health Policy NHP was framed and developed in the year 1983, 1993, 2002, 1975. Correct answer is the first National Health Policy was framed and developed in the year 1983. Okay, next question. Drugs stored in cool temperature are stored at 8 to 25 degrees Celsius, 2 to 8 degree, 30 to 40 degrees Celsius, above 40 degrees Celsius. Drugs stored in cool temperature was stored at 8 to 25 degrees Celsius. Next question. Individual prescription order belongs to outpatient, inpatient, complete floor stock system, unit dose dispensing system. Individual prescription order belongs to option B, inpatient. Straight catheter is designed for bladder, intestine, kidney, liver. Straight catheter is designed for option A, bladder. Next question. Agents used for reducing acidity in stomach is termed as. Agents used for reducing acidity in stomach is termed as adsorbent, protective, acidifier, antacid. Correct answer is option D, antacid. Next question. Bioavailability is defined as rate of drug distribution, rate of drug absorption, rate of drug elimination, rate and extent of absorption. Correct answer is rate and extent of drug absorption. Bioavailability is defined as rate and extent of drug absorption. Next question. Antihypertensive drug combinations to be avoided except amlodipine plus beta blocker atenolol, diltiazem plus beta blocker atenolol, methyl dopa plus clonidine, diuretic plus beta blocker atenolol. Antihypertensive drug combination to be avoided except option A, amlodipine plus atenolol. Next question. What type of biological characteristics can be predicted in paracetamol adverse drug reaction causing hepatotoxicity? What type of biological characteristics can be predicted in paracetamol adverse drug reaction causing hepatotoxicity? Type A, augmented reaction, Bizarre reaction, chronic reaction, end of use reactions. Chronic reaction. Option C, Type C, chronic reactions is the correct answer. Next question. The autocoid used for abortion is histamine, 5-hydroxytryptamine, prostaglandin, platelet activity factor. The autocoid used for abortion is option C, prostaglandin. Next question. The most effective drug for the treatment of migraine is most effective drug used for the treatment of migraine is ergotamine, promethazine, ondansetron, risperidone. Correct answer is option A, ergotamine. Most effective drug used for the treatment of migraine is ergotamine. Next question. Which of the following is a G protein coupled receptor? Which of the following is a G protein coupled receptor? Muscarinic cholinergic receptor, nicotinic cholinergic receptor, glucocorticoid receptor, insulin receptor. Correct answer is option A, muscarinic cholinergic receptor. Next question. Which of the following drugs is commonly administered in intranasal route? Administered to intranasal route. Adrenaline, desmopressin, ganirix, insulin. Correct answer is option B, desmopressin. Intranasal route. Okay, next question. Aspirin prolongs bleeding time by inhibiting the synthesis of. Aspirin prolongs bleeding time by inhibiting the synthesis of cyclic adenosine monophosphate in platelets, clotting factor in liver, prostacyclin in vascular smooth muscle, thromboxane A in platelets. Correct answer is option D, thromboxane A in platelets. Which of the following drug is a angiotensin receptor blocker? Labetalol, lisinopril, losartan, parazosin. Which of the following drug is a angiotensin receptor blocker? Correct answer is option C, losartan. Next question. The common side effect of thyroid hormone is increase in basal metabolic rate, angina pectoris, nausea, exothalamus. Okay, correct answer is option D. Next question. Choose an emetic drug of central action. Choose an emetic drug of central action. Ipecacuanha derivatives, promethazine, tropiceron, apomorphine hydrochloride. Correct answer is emetic drug for central action is apomorphine hydrochloride. Okay, next question. Selective estrogen receptor modular is flumazenil, tamoxifen, diazepam, halothane. Correct answer is selective estrogen receptor modulator is option B, tamoxifen. Next question. Aromatase inhibitor. Letrozole, ketamine, aspirin, timolol. Correct answer is letrozole. The following crude drugs are used as antiseptics except. The following crude drugs are used as antiseptics except neem, curcuma, benzoin, Google. Correct answer is option D. Next question. Balsams contain mainly acids like acetic acid plus benzoic acid, cinnamic acid plus benzoic acid, citric acid plus benzoic acid, tartaric acid plus benzoic acid. Balsam contains mainly acids like option B, cinnamic acid plus benzoic acid. Next question. Trachispermum amy is a botanical name of castor oil, nutmeg, catechu, ajowan. Correct answer is option D, ajowan. Next question. The drug which belongs to Polygonaceae family is rhubarb, nutmeg, castor oil, arjuna. Drug belongs to Polygonaceae family is option A, rhubarb. Next question. Borhiva diffusa belongs to the family Genitaceae, Nectaginaceae, Ranunculataceae, Rubiaceae. Correct answer is option B. Okay. Next question. Stratified cork is present in Rauwolfia root, Ipecac root, Aconite root, Ashwagandha. Stratified cork is present in option A, Rauwolfia root. Next question. Which one of the following is a water soluble? Ergocrestin, ergocryptin, ergotamine, ergometrine. Which of the following is a water soluble? Option D, ergometrine. Okay, next question. Dash is used as galactogug, shatavari, linseed, Dioscorea, garlic. Correct answer is option A, shatavari. Next question. Vitalis Morin test is answered by dash alkaloids: tropane, quinoline, pyridine, purine. Vitalis Morin test is answered by tropane alkaloids. Next question. Dash type of stomata is present in the crude drug clove. Dash type of stomata present in clove. Anisocytic, anamocytic, parasitic, diacytic. Correct answer is option B, anamocytic. Okay, next question. Which one of these is an antioxidant? Kaolin, calcium carbonate, bentonite, sulfur dioxide. Which one is an antioxidant? Correct answer is option D, sulfur dioxide. Magnesium trisilicate has a molecular formula. Magnesium trisilicate has a molecular formula. Option B. Next question. Dry ice is a solid form of oxygen, nitrous oxide, nitrogen, carbon dioxide. Dry ice is the solid form of option D, carbon dioxide. Sublimed sulfur is used as anti-amoeboic, scabicide, keratolytic, mucolytic. Sublimed sulfur is used as, correct answer is option B, scabicide. Next question. How would you diagnose aplastic anemia? How would you diagnose aplastic anemia? Bone marrow biopsy, blood smear, spleen biopsy, complete blood count, CBC. Okay. How would you diagnose aplastic anemia? Correct answer is bone marrow biopsy, blood smear. Option A and B. Next question. Atomic mass of calcium. Atomic mass of calcium is option C, 40.078. Next question. Which one of the following statement is correct? Barium sulfate is soluble in water. Barium sulfate is soluble in acids. Barium sulfate is soluble in alkaline medium. Barium sulfate is insoluble in water, acid and in alkaline medium. Statement is correct. Option D, barium sulfate is insoluble in water, acid and in alkaline medium. Next question. Sodium nitrate is prepared by strongly heating sodium nitrate, strongly heating sodium carbonate with sodium nitrate, strongly heating sodium nitrate with calcium carbonate, strongly heating sodium nitrate with sulfuric acid. Sodium nitrate is prepared by strongly heating sodium nitrate. Option A is the correct answer. Next question. Bismuth carbonate turns dash color on exposure to sunlight for long period. Bismuth carbonate turns to black or yellow color on exposure to sunlight for long period of time. Okay, next question. In the limit test for arsenic, all the arsenic acid present is reduced to options: hydrogen sulfide, acetic acid, arsine, trivalent arsenic acid. Correct answer is option C, arsine. Next question. Co-trimoxazole is a combination of 5 parts of sulfomethoxazole and 1 part trimethoprime, 4 parts sulfomethoxazole and 1 part trimethoprime, 3 parts sulfamethoxazole and 1 part trimethoprime, 2 parts sulfamethoxazole and 1 part trimethoprime. Correct answer is chlortrimoxazole is the combination of 5 parts of sulfamethoxazole and 1 part trimethoprime. Okay, next question. Brand name for benzyl penicillin potassium is crystalline penicillin G, sodium penicillin G, amoxicillin penicillin fortified. Correct answer is option A, crystalline penicillin G. Brand name for benzyl penicillin potassium is crystalline penicillin G. Next question. Aminophylline is caffeine with ethylene diamine, theophylline plus etiophyllene, caffeine with etiophyllene, theophylline plus ethylene diamine. Aminophylline is combination of option D, theophylline plus ethyl diamine. Next question. The adrenergic blocker that exists in polymorphic form is cardiolol, labetalol, metoprolol, atenolol. The adrenergic blocker that exists in polymorphic form is option A, cardiolol. Quinidine is chemically 6-methoxychinchona-9-ol. Okay, next question. Adrenergic neuron blocker is atenolol, parazosin, methyl-dopa, guanidine. Correct answer is guanidine. Next question. The main molecular target for alkylation in DNA by alkylating agents: N and N of adenine, N of guanine, N and N of guanine, N of adenine. Correct answer is option B, N of guanine. Next question. L-asparginase is used to treat acute lymphoblastic leukemia, breast cancer, ovarian cancer, lymphoma. L-asparginase is used to treat acute lymphoblastic leukemia. Next question. Which of the following is used to detect amyloidosis? Azovan blue, Congo red, propyl iodine, NVAS blue. Correct answer is option B, Congo red. Next question. Ibugesic is the brand name of which drug? Aspirin, paracetamol, indomethacin, ibuprofen. Ibugesic is the brand name of which drug? Option D, ibuprofen. Next question. Gelatin is used as emulsifying gel in the concentration of. Gelatin is used in the emulsifying gel in the concentration of 1%, 0.5%, 10 to 20%, 5 to 10%. Correct answer is 1%. Gelatin is used as emulsifying gel in the concentration of 1%. Next question. Example of suspension produced by chemical reaction. Example of suspension produced by chemical reaction: sulfur lotion, zinc sulfide lotion, sulfur diamide mixture, chalk and opium mixture. Example of suspension produced by chemical reaction. Correct answer is option B, zinc sulfide lotion, BPC. Okay, next question. Which one is not a gelling agent? Methyl cellulose, carbomer, pectin, dicalcium phosphate. Correct answer is option D, dicalcium phosphate. Next question. The maximum concentration of selenium sulfate in shampoos for treatment of dandruff is. The maximum concentration of selenium sulfate in shampoos for treatment of dandruff is 10%, 1%, 2.5%, 25%. Correct answer is option C, 2.5%. The maximum concentration of selenium sulfate in shampoos for treatment of dandruff is 2.5%. 87. Question number. Cleanup area means area should be kept clean, filling area, finishing and packing area, disposal area. Cleanup area means area should be kept clean. Next question. To detect faulty seal packing in the ampules are completely immersed in 2% crystal violet solution, 3% gentian violet solution, 1% methylene blue solution, 2% amaranth solution. Correct answer is option C, 1% methylene blue solution. Next question. Some crystalline substance liberate water. This process is called. Some crystalline substance liberate water. This process is called efflorescence, eutectic, hygroscopic, explosive. Correct answer is option A, efflorescence. Next question. Snuffs are nasal spray, aerosols, powders, syrup. Snuffs are option C, powders. The common criteria used to determine the correct pediatric dose of a drug. Common criteria used to determine the correct pediatric dose of a drug: age, weight, gender, body surface area. The common criteria used to determine pediatric dose: age, weight, gender. Okay, next question. 1 drop is equal to 0.06 ml, 0.4 ml, 0.8 ml, 15 ml. 1 drop is equal to 0.06 ml. Next question. How many types of condensers are used in distillation? 2, 3, 4, 6. Correct answer is option B, 3. In the construction of distillation, still receiver is used to place materials to be distilled, as vaporizing chamber to collect distillate, to condense the vapor. Correct answer is to collect distillate. Which of the following is used to prepare entry coating? Cellulose acetate phthalate, polyethylene glycol 400, sugar, starch. Which of the following is used to prepare entry coating? Correct answer is option A, cellulose acetate phthalate. Which type of tablet dissolves more quickly? Chewable tablet, sublingual tablet, film coated tablet, entry coated tablet. Correct answer is option B, sublingual tablet. Okay, next question. Foodstuff dehydrated by freeze drying are referred to as glycication, fortification, solidification, sonication. Correct answer is option A, glycication. Next question. Immunoglobulin and cytomegalovirus immunoglobulin are administered by dash route: intravenous, intramuscular, subcutaneous, intrathecal. Correct answer is intravenous, intramuscular, subcutaneous, intrathecal. Next question. In size reduction process, thermolyable substance can be milled by using fluid energy mill, ball mill, hammer mill, disintegrator. Correct answer is option A, fluid energy mill. Next question. The porous medium used to retain the solids is described as dash, and the accumulation of solids on the filter is referred to as dash. Correct answer is the porous medium used to retain the solvent is described as the filter medium, and the accumulation of solids on the filter is referred to as the filter cake. Okay, first batchல இருந்த கூடிய 100 questions இப்போ நம்ம பார்த்தோம். இதே மாதிரி ரிமைனிங் 3 batchஸும் வீடியோஸ் அப்லோட் பண்ணுறோம்.